UK Health Security Agency has warned of a possible difficult winter of flu and COVID circulating widely.
Yes, it's a so-called twindemic. They say it could be compounded by lower levels of natural immunity to flu because of the COVID lockdowns. So health officials encouraging the clinically vulnerable and elderly to receive both COVID and flu jabs together in light of the risk.
Well, Professor of Primary Care and Public Health at Imperial College London, Azim Majid, joins us now. How worried, let's take them both in turn. First of all, how worried are we about a resurgence of COVID?
Hello, Gloria. I think it's very likely we'll see more waves of COVID this winter. We saw big waves last year and the previous year, so I think we will see another wave of COVID in the autumn and winter. But hopefully with vaccination, we can keep down the number of serious cases and deaths to a level where we don't need any more measures being brought in by the government to control the pandemic.
And of course, let's reflect, flu can be as dangerous, if not more so, than COVID, particularly if you have underlying conditions, of course. And we remember the Spanish flu outbreak back in 1918 that killed millions. Is it the case that we've lost the natural immunity because we've all been shut away for 2 years?
It is the case that for the past 2 years we've had very low rates of flu, and that does mean people have got less immunity to flu this winter than in previous years. We also have more mixing of people this winter, so unlike the last 2 years, there's no measures brought in to mix social events, etc., encourage home working. So we will see more mixing of people, and that will also drive up flu rates as well this winter.
So how important is it for people to get a vaccine? Haven't we all got vaccine fatigue?
I think we have got vaccine fatigue in the population, but I do think it's essential for people to get vaccinated. So if you're over 50 or in a high-risk group, if you've got a long-term health condition, you're a healthcare worker, you're a carer, very important you get your flu vaccine and your COVID vaccine this autumn. I've had both my vaccines, and I encourage everyone else to get their vaccines as well.
Are the public health officials and the doctors actually giving the double jab in one then when you go to get your booster this autumn?
That's right, yeah. So most people are getting both jabs together. So I had my 2 jabs at the same time, one jab in each arm. So that is more convenient for people and therefore encourages a better take-up of both vaccines.
Warm people actually seeing a jab taking place at the moment, which Gloria is shying away from.
I'm absolutely needle phobic, but I am vaccinated, but not without a good bit of drama. Now, we've all, well, so many of us, most of us have had COVID. It does seem that the strains are getting weaker. Can we take any hope that if each strain becomes weaker, and actually even if COVID levels do rise come the winter, we're not going to be see the corresponding level of hospitalisations and deaths?
Yeah, it's the case. We've been lucky. The last few variants have been less serious than earlier variants, but there's no guarantee that will occur in the future. We may see a variant that is more deadly than current variants, so vaccination remains very important in suppressing serious cases and deaths. So yes, let's hope we get milder variants in the future, but that's not something that we can guarantee.
Have you been jabbed yet yourself?
Yes, I've had both my flu and COVID jabs about 2 weeks ago, so I'm fully prepared for this winter.
Excellent. I think I got mine on Friday. So,
have you?
Yeah.